Should my doctor routinely check my cervix near the end of my pregnancy? The bottom line up front is no. Stick around and I'll tell you why. A lot of obstetricians and midwives will routinely perform cervical exams at each visit, starting at 35 or 36 weeks gestation. Many patients are very eager to find out if they're dilated, and if so, by how much. The assumption for both the doctor and the patient is that the amount of dilation indicates when she might go into labor. But it doesn't. It just doesn't mean anything. It doesn't predict when she'll deliver in any meaningful way, and it likely leads to an increased number of unnecessary inductions of labor while causing women discomfort. The exam is uncomfortable, embarrassing, and very frequently stirs up spotting or other symptoms which the patient may confuse with labor. This means these unnecessary exams can lead to unnecessary hospital triage visits. A woman with a closed cervix might go into labor the next day, or might stay pregnant for 3 or 4 more weeks. In the same way, a woman who is 3 or 4 centimeters dilated might go into labor the next day, but also might stay pregnant for a few more weeks. While it's generally true that women who are more dilated will have less need of induction compared to women who are not dilated, the difference is so nonspecific that it can't be used to reliably counsel a patient. In other words, what you were dilated at 37 weeks gestation just doesn't matter and won't help you or your doctor plan for anything. The scientific literature regarding cervical dilation in labor revolves around induction of labor. If you have a higher Bishop score, which measures 5 characteristics of the cervix for their favorability for labor, then you'll have an easier and quicker induction of labor. But it doesn't relate to when you might go into spontaneous labor. It does not have predictive value. Your doctor should check to make sure that the baby is head down at 36 to 37 weeks, but this is easily done by feeling the head through your belly. If your doctor isn't sure what he's feeling, then an ultrasound is usually necessary. Sometimes it seems like the last few visits of your pregnancy don't serve a specific purpose, so your doctor or midwife might use the cervical exams to make the visit feel more meaningful. But the reason for these visits is mainly to check your blood pressure and look for other problems or complaints that might indicate some problem. Like all tests and exams, cervical checks should be done with a specific intent and purpose. If you're planning on an induction, performing a cervical exam can help inform the method and sensibility of proceeding with an induction. But that exam should be done just before the induction is planned, not weeks in advance. If you're having regular uterine contractions, something less than 5 minutes apart, let's say, then a cervical exam can help determine if you're in labor. If you're beyond 39 weeks gestation and would like to have your membrane swept in an attempt to reduce the likelihood of an induction, then do it. Apart from these reasons, there really is no point in a cervical examination. We should not do tests or exams that don't change what we're planning to do. This is all the more true if something as invasive and uncomfortable as a pelvic examination. So don't ask for cervical exams unless there's a specific reason to get one, like you think you might be in labor or you need to schedule an induction in the next week or so.